Hello, friends. Welcome to Creative Medicine. In this lecture, we will learn about
What are the treatment options for hepatocellular carcinoma? So, treatment options for hepatocellular carcinoma are: first, we have surgical treatment options. In the surgery, we should advise the patient to undergo resection or orthotopic liver transplantation can be done. Then we have ablative procedures. In the ablative procedures, we can give an ethanol injection or acetic acid injection, or we can do a thermal ablation by cryotherapy, radiofrequency ablation, or microwaves. With all these chemicals or by thermal ablation, we are going to destroy the tumor tissues, thus resulting in decreased hepatocellular carcinoma. Then sometimes we can do even the combination therapy can be done, especially combination of trans arterial and ablative procedures can be done. Then what are the transarterial procedures? Transarterial procedures which can be done are: in the transarterial procedures we can do embolization, chemoembolization can be done, and radiotherapy can also be given. Then then in the systemic treatment is: we can do chemotherapy, hormonal therapy, and immunotherapy can be done. Finally, we can also do an external beam radiotherapy can also be given for the treatment of hepatocellular carcinoma.
thank you and thank you for watching.